So what are the options if a denture wearer goes to your practice? What are the options when it comes to dental implants?
We can do something that's still removable. It snaps in and snaps out. But what that does, the advantage, is that you no longer need to use dental adhesives. And you can enjoy way more foods on the menu than you used to be able to enjoy because it doesn't move around on you.
So you could chew like chewy things?
Absolutely. Absolutely. I mean, you might be limited to something super sticky, for instance, but for those patients that want to take it up a notch, we have something that's actually fixed in place. You're getting fixed teeth back that don't come out at all. And just like I talked about on the bottom, the more implants we put in, the stronger it is. It's just like if you're building a house, you want to have more support. Just makes it stronger. And there's a trend that's become very popular. It's called all-on-4, and we do offer that. But
That's
I tell
4
patients,
implants on teeth.
exactly
on 4
right.
implants.
Exactly right. Fixed teeth sitting on 4 supports. So I tell patients that, just like any structure, the more supports you have, the more stable it is, the stronger it is. So we'll often talk about putting in more like 6, or sometimes even 8, just because it's a stronger, longer lasting result.
Because these teeth could last like 20, 30 years.
Easily. In
For
fact,
somebody
even
in
longer.
their 50s or 60s or whatever.
Absolutely. If you take good care of them, you come in for regular visits, we've seen them last decades.
Now what about the upper?
The upper is even more remarkable because when you're wearing something that covers the roof of the mouth, you often miss out on the full flavor of foods, the temperature of foods. The tongue has less space, so you may have a speech impediment because of it, and you don't have to use any goopy materials. So when we give them back rock solid dental implant supported teeth, it's life-changing. You're back to like when you're in your 20s.
So they could eat whatever they want.
Anything on the menu. There's no limitation at all.
So when they have the upper and lower, like let's say 4 or 6 implants on the lower, 6 on the top or whatever, the teeth don't come out. I mean, they could eat now like pizza or steak.
Absolutely.
What about like carrots could they bite the front of their teeth with like a hard...
Yes, they can. There's absolutely nothing on the menu that's off limits now, which for denture wearers is radical. It's really taking them back to an early point in their life when they used to enjoy all the foods on the menu, as opposed to denture wearers that have to limit themselves. They may look at a menu and say, I can't have that, especially not in public. I should say that, at least not in public, because I don't want something to fall out, or I don't want to have trouble chewing, I don't want to choke on my food, I don't want to have to go to the restroom to take out whatever's stuck underneath. I mean, that's what a denture wearer's life is like. So when they get fixed teeth back, it changes their world.
So no more dentures.
There's no reason for it. Anybody's a candidate, virtually anybody.